Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi, my name is Dr. Stephen Dayan. I'm a board-certified facial plastic surgeon in Chicago, Illinois, and also a clinical assistant professor at the University of Illinois. I'm excited to talk to you today about an article we have coming up being published in Facial Plastic Surgery and Aesthetic Medicine. It's about lip augmentation in skin type patients 5 and 6. The official title of the article is Lip Augmentation in Patients with Fitzpatrick Skin Types 5 and 6, Use of a Validated Lip Fullness Scale to determine pre-injection lip size preference and post-injection post-satisfaction. The reason for this study is that many patients who are skin types 5 and 6 may get overlooked because historically they have what are considered larger lips based on the validated lip fullness scale. So the original lip fullness scale didn't really take into account patients with larger lip size. Now the one that was revised in 2015 does take into account larger skin types, larger lip sizes with patients with skin types 5 and 6. But if you look at the studies that were pivotal to get Hyalocross and Vicross approved for FDA approval, those studies did not include patients with larger lips. Now, when we look at lip studies, we use a photonumeric scale. It's a 5-point photonumeric scale that's called the lip fullness scale. It starts from minimal to mild to moderate to marked to very marked. It's a 5-point scale, and we'll show it to you here. Most patients who were in clinical trials when these products were approved for the lips were either minimal or mild, which means they were 1 or 2s on the lip fullness scale. So it didn't take into account patients who are skin type 5 and 6 who may have larger lips by nature, that many of them are marked or very marked. Some of them are moderate. So we decided to design a study to see, are these patients interested in getting lip augmentation? Why are they interested in getting lip augmentation? And will they be satisfied if we do treat them with fillers? So we got IRB approval for this clinical trial, and then we enrolled 22 patients with skin types 5 and 6. And these patients were of African American, Asian, or Hispanic origin. The patients then were asked to look at the lip fullness scale and tell us which size lip they thought they were and which size lip they thought was best. On average, the patients thought of themselves around a 3.5, so moderate to marked, in between those two levels. They desired a lip size of 4.5, so very marked, between marked and very marked. So they wanted bigger lips. Now, if you look at them historically, you might say, well, these patients have large lips, they wouldn't have qualified for our studies, but the reality is that these patients, even with historically large lips, want them even more volumized. Not necessarily augmented, but volumized. They find benefit in getting filler. So we went ahead and treated these patients, and I put in approximately 1.37 cc's between the upper and lower lip on the first treatment. Then we had them come back 2 weeks later, and we asked them if they reached optimal correction. And if they did, we stopped there and took photographs. And we regraded their lip size, and we asked them what size they thought they were. If they weren't happy with their lip sizes and they want them bigger or more augmented, I treated them again. And on average, for the 8 patients who wanted more treatment, I put in another approximately half cc into the upper lip and half cc into the lower lip. And then we had them come back at 2 weeks, and we took photos of them also. Then looking at all 22 patients and their satisfaction, we also did a face Q. A face Q is a way of measuring patient satisfaction rate and to see how this impacted their quality of life and self-esteem. Afterwards, what did we find in our clinical trial? Well, majority of patients felt that their lip size reached a 4.3 on the scale. They desired a 4.5, but they reached a 4.3. Principal investigator rating showed a 4.5, whereas the patients thought they had a 4.3. So principal investigator ratings thought was a little bit higher than the patients, so a little bit of a discrepancy there, but pretty close to what the subjects had rated themselves. Looking at satisfactions, patients overall were very satisfied with the outcomes that they received from the treatment. So what we learned from this is that, yes, patients who are darker skin types and have bigger lips, historically, they come in with a marked to very marked. So on the photonumeric scale, maybe a 3, 4, or even a 5, still desire their lips to be treated. And this proves that those patients do benefit from getting treated. They do appreciate the fullness in their lip. They do appreciate the way that their lip is pouts. and they were very satisfied with an increase in lip size. So I think for the patients for the doctors out there and the providers who may be overlooking this patient population, they are a good patient population to be treated, and that you may need to check your aesthetic bias somewhat and talk to these patients about what their desires are, and maybe they want lip augmentation. It might be something to offer these patients, knowing full well that the satisfaction rate is very high when these patients are treated with lip filler. Thanks so much.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.